My name is Annalisa Routine and I am a student nurse. Health history forms a key part of my role. History taking forms have set the cornerstone of patient health assessment. To do that, I am going to bring and demonstrate the key steps involved in history taking. Hi, please come on in and have a seat.
Thank you.
My name is Annalisa Routine.
Thank you.
To meet you too, I'm your student nurse for today. May I know your name, please?
Michael.
Michael. Oh, Michael, so what name do you prefer me to call you?
Mickey.
Mickey. Okay, Mickey. So before we proceed, I want to ask you some questions to have a full understanding of what your condition is. And I will ask your psychosocial status. Is that okay with you?
Sure.
Okay, great. Okay, so before I proceed, I want you to check this if this is correct. Your name is Michael, and is that your address?
Yes,
and
that looks correct.
And you are 62 years old, right?
Yes.
Great. Okay. So, Michael, how can I help you today?
Mickey.
Mickey, I'm sorry, Mickey.
That's fine. Well, I've got this lingering cough that I can't seem to get rid of.
Okay, so you have a lingering cough.
Mm-hmm.
Okay, so how long the cough have been there?
For about a month.
A month, okay. So have you got any symptoms with that?
Well, I wake up in the morning and my sinuses are kind of full, and it takes me a while to cough out the mucus. Usually around noon it's not so bad. If I spend too much time in air conditioning, it gets worse.
Oh, all right. So, do you have any sore throat in there?
No sore throat at all.
So just only like a sinus, right?
Sinus, yeah, it's something dripping down into my throat. I'm not sure exactly what.
And it is during the day or night?
Usually it's in the morning.
In the morning. Okay, so
it takes me a while in the morning to cough up all of the phlegm. Yeah.
What do you think the color of can you see the color of your phlegm?
Yeah, it's clear.
It's clear. Okay. So are you able to swallow?
Yeah, no problem.
Okay, no problem. Can you describe me a little bit more about the coughing?
Sure. There's an example right there. No, I wake up in the morning and I feel a tickle in my chest, and I cough up phlegm and I'll spit it out, and every few minutes I cough up a little bit more, and usually after about half an hour or 45 minutes I've coughed up all the phlegm and it's over around the time I finish my first cup of coffee.
Okay, so it's a tickle in your chest and you cough up like few minutes. Okay, so if you rate your cough 0 to 10, 0 means none and 10 is the worst, what is this scale of your cough?
I'd say a 2 or a 3. It's not terrible, it just isn't going away.
Okay, so pain in your body?
No, not at all.
Okay. I will ask you specific question. Is that because of this pandemic, have you traveled a lot or?
We've traveled a little bit around the island, but not very far.
Okay, outside of the Philippines, no?
No, not at all.
Person in your family coughing?
I haven't noticed.
Okay. So what do you think that cough makes you better? I mean, did you take anything, any medicine for that?
What makes the cough better? I think that when I have my first cup of coffee, it kind of washes it down, and then I'm better.
What makes the cough worse for you?
When I lay down, especially in a air-conditioned room, if the air conditioning is blowing directly on me.
Okay, I guess that cough.
I think it's just the difference between the hot, moist air in the room and the cold, dry air of the air conditioning. I think that it somehow that brings up a cough.
Okay, so when you cough, is there any blood in it?
No, never.
No. Never. Okay. Do you feel like you have fever or feel cold?
No, I feel fine.
Fine. Okay. Have any breathing problem?
No, everything seems to be fine. It's just when I'm congested with this cough, sometimes I hear a little raspy sound, but other than that, no.
Have like a little bit congested and have raspy sounds when you breathe, right? We'll ask you specific questions about body systems or your overall health. And do you have any breathing problems, or you have heart attacks or something?
I had a heart attack about 5 years ago in China.
Okay. So have you, after that, so 5 years you've got heart attack, and after 5 years, have you got a chance to see your doctors?
I saw my doctor regularly when I was in China for the first 2 years after the heart attack. I visited my doctor once a month.
Okay, once a month. Okay. So how about artery disease? Do you have any?
Not that I know of.
How about high blood pressure?
I have high blood pressure, but it's under control with medication.
Okay. So can I ask what medicine are you taking for your high blood pressure?
I take a few different medicines. I can give you the list.
Okay. So when you take that medicine, how often did you take that medicine?
Every morning I have to take 5 pills, and some of the pills are for blood pressure, some are for cholesterol.
Okay. May I know what milligrams?
I'll give you the list of the medications and the milligrams.
Okay. So how about liver disease? Do you have any of this?
I have what's called a fatty liver, but I've had this for many years, and the doctor tells me that it's genetic because my father had it too, and not to worry too much about it.
Okay. So heartburn.
I take medication every day. I take a pill for heartburn every day for acid reflux.
Okay, for acid reflux. Okay. Arthritis.
Knees and a little bit of my fingers also.
And I will ask you some questions about if you've done the measles and immunizations like chickenpox vaccine, hepatitis B vaccine, influenza, and pneumococcal vaccine and tetanus booster, or have you done to? Yeah.
I was current with my tetanus shots until 5 years ago. I don't think I've had a tetanus shot in the last 5 years. As far as the flu shot, I took a flu shot annually until 3 years ago. I haven't had a flu shot in the last 3 years. The childhood diseases, I've been immunized for all of those.
Okay, all right. I'll just go back to your past history, your surgical history. You mentioned that you got a heart attack in 2016, right? Okay. And hemorrhoids, do you have any hemorrhoids?
I had hemorrhoids, and I had surgery for that maybe 30 years ago.
Okay. So I want to ask more questions about...
I also had surgery on my leg.
Oh, okay.
I had compartment syndrome in my leg.
Okay. To ask if anyone in your family has this disease like cancer?
My brother died from cancer 2 years ago, and my father has had bladder cancer.
Okay. And your brother died because of cancer.
Yeah.
May I know what type of cancer it was?
It was pancreatic cancer.
Okay, pancreatic cancer. Okay. So, is there anyone in your family have the congestive heart failure?
Not that I know of.
Okay.
Congestive heart failure?
Yeah.
Not that I know of.
And coronary heart disease?
Me?
In your family?
My father has had 2 stents, and he also had a valve replaced in his heart.
Okay, so high blood pressure.
Both me and my father have high blood pressure.
Do you have any siblings? Another more aside from your brother, do you have sisters?
Yeah, my sister does not have high blood pressure.
Okay. About high cholesterol.
I take cholesterol medication every
And
day.
you're in your family also? They.
I don't know.
Okay. So how about kidney diseases?
None.
Chronic lung disease?
None.
Okay. So rheumatoid arthritis?
Like I told you, I'm beginning to get a little bit.
Okay. So aside from those I mentioned, do you have in your family do they have some other past history about surgical
Not that I
history?
can think of.
Okay. Or any sickness? No.
Not that I can
Okay.
think of.
Do you have any head injuries?
Not that I know of.
Okay. So how about your vision?
I wear corrective lenses, but my vision hasn't changed much in the last 20 years.
About nasal congestion?
Just in the morning.
So how about your taste?
My taste seems to be fine.
Is there any problem with your chest or your heart?
No.
Mickey, can I ask you about your social status? How do you do your exercises? Or are you doing your exercises?
Bicycle.
Wow, that's great. So, but you do walking also, right?
Occasionally.
Occasionally. So, what is occasionally, like once a week or every morning?
Usually every weekend we go somewhere where I do a considerable amount of walking. In addition to that, we go swimming on weekends. But during the week, maybe once every week or so, I take a walk.
That's good. So, how about your diet?
We eat mostly at home, so my diet is usually good quality food. I do have a tendency to eat at fast food too often, though.
Okay. So how about your caffeine?
I usually have 2 to 4 cups of coffee a day. I don't drink that much soft drink, usually 1 glass.
You have some breathing, like it tickles on your cheese the few more minutes when you breathe or when you cough. When you cough, right?
Before I cough.
Before you cough, yeah, you are using pillow when you lie down on bed. That it helps, right? And it's because of sometimes you are using, because most of the days, not sometimes, but most of the day and night you are using air conditioner, right?
Yeah.
Okay, so is there anything else I can add before I check your vital signs?
I don't think so.
Okay, great. So thank you for your cooperation, and I will start taking your vital signs.
Thank
okay?
you.
Bye-bye.